Okay, we're live. Hi, everyone. Thanks so much for joining. I'm Megan, and this is the fifth and final episode in a series, Dog Training Won't Solve Your Problem If. And today's episode is about the relationship between pain and behavior. So, dog training won't solve your problem if we mistake pain for bad behavior. I've really been enjoying doing this series to kind of go beyond dog training and kind of ask us to see dogs in their wholeness and to reimagine a relationship with their human kin based on reciprocity and challenging the kind of top-down power over relationship of the trainer paradigm. So today I'm really excited. I'm joined by Dr. Josie Beug and of Josie's Animal Wellness. Hi, Josie.
Hi there,
Hi. How
Megan.
you doing today?
Good. Thank you for having me on.
Yeah. Where are you joining us from?
I'm in Florida. I'm in South Florida, Miami, Fort
Oh,
Lauderdale. So yeah,
great. Probably much sunnier than where I am, which is London.
yeah, it's nice
Okay,
and warm.
nice. I'm like only a little jealous.
Yeah.
Okay, so Josie, thanks so much for coming on here. And I'd really love to just get started by hearing about you and the work that you do and your background and what led you toward like a holistic whole dog approach to veterinary medicine.
I'll try to keep it somewhat short so we can get to the topic. But I grew up with animals. My family came from like small farming families and ranching families. So we always had a whole bunch of menagerie of animals around us. But I I was going to go to medical school, and then I got really burnt out on the way that they weeded people out for pre-med at the time. And I was like, well, what is my true passion in my heart? And if I'm going to spend all this money, what do I want to study? And it was animals. So I went and got a biology degree. But what was really cool, I ended up going to the University of Colorado, and there was a professor there, Mark Beckoff. And I don't know if you're familiar with him or not, but
No.
he he's a biologist and animal behaviorist. He actually coined the term playbow, but he
Oh,
went out and studied. You have to look him up. He went out and studied wild coyotes in Wyoming and studied dog behavior from like the wild dog behavior. And he taught this class at the University of Colorado with the philosophy department called Animal Consciousness
whoa.
and how animals think, and challenged at that time, it was in the 80s, he was challenged in the belief that animals didn't have a soul or animals didn't have self-awareness. And for that was a graduate level class, and he let me join in as an undergrad. But I wrote this amazing paper, I had so much fun doing it, about the perceptual world of animals and how
Mm.
they perceive the world differently based on their sensory systems and their like operating systems. So, dogs have this huge olfactory system that's larger than our visual system in our brain.
Mhm.
So that's where I started out. And then I didn't know what to do after that. So I got a job working in animal shelters. And I actually worked in animal shelters for 8 years. But that gave me I was there at observing behavior. I learned from him how to like just sit and observe behaviors in dogs. And I had some really good kennel managers at the time and supervisors who we would just take. She trained me by walking through the dog kennels, and there were dogs in and out of there all the time under really stressful conditions. But
Mhm.
I learned to read their behavior really well. And then I'm like, well, what am I going to do with the rest of my life? Because I can't, I was burning out on shelter work. And I found out that people were doing alternative medicine for animals. So acupuncture and herbs, which I was already doing for myself. And I was like super excited because I'm like, I combine these two, passions of mine. But I couldn't just jump into acupuncture school. I had to go through veterinary school first. And so I
Mhm.
went to veterinary school because I wanted to practice herbal medicine and acupuncture and chiropractic and all these cool things on animals. So, and then as soon as I got out, I graduated from vet school. I got my acupuncture certification, and I started a house call practice that has just it's been going now for 25 years in South Florida. So,
Wow.
yeah.
Wow, that's amazing. Yeah, cool. And like such a journey through different things and having that kind of aha moment where you're like, I can do this and I can combine it with this. And
Yeah.
yeah, like
Yeah.
really connected to purpose on multiple levels. That's cool.
Yeah, I mean, it didn't seem like that at the time
Sure.
because I'm wandering, but now I look back and it was like I followed the breadcrumbs and I followed my heart, honestly. I had a really good kind of guidance counselor at the time, and he's like, go follow your passion. That's what matters. And so I tell younger people that all the time, really get to know what's in your heart.
Yeah. Oh,
Yeah.
lovely. Okay. Oh, um, so yeah, so I just want to bring us into our topic of today because
Uh-huh.
I think it's incredibly important from like an awareness perspective. As someone who works on the behavior side with clients, um,
Mhm.
I often yeah, I understand that like these kind of like problem behaviors or, when someone seeks out a dog trainer or a behaviorist, it's usually because there's a behavior that their dog is expressing that is not helpful or conducive to them having like a smooth life with the dog, right?
Yeah.
And they're looking for a solution to that. And I think a
Mhm.
common pathway people understand that solution is dog training, right? But actually, like from the work that I do, what I've come to understand time and time again is that when a dog is expressing these types of behaviors, it's often because of, well, from my knowledge, like an
Mhm.
arousal problem, or they're afraid, they're acting from a place of fear or overstimulation or trauma that is like chronic
Mhm.
or acute. But then there's this
Mhm.
kind of whole other realm of potential causes that is more to do with their physical experience and how
Mhm.
much like pain can behavior can indicate underlying pain. um and so I guess I'm wondering, the first thing is like kind of what physical kind of cues or behaviors might suggest that a dog is in pain?
Yeah, well, and dogs, I think people have to understand that dogs are trying dogs have a much tougher job than we do because they can't use our words to communicate with us. So they are constantly trying to find ways to communicate with us. And I see so much problem behavior in dogs is the dog is just trying to tell the people something and the people aren't listening. And most of the time it's because they're in their phones. Oh, my dog's misbehaving. I can't figure out I can't keep scrolling because my dog's trying to get my attention. So that's a big so we have to look at their behavior as they're trying to communicate with us. And,
Yes.
with pain, pain's a really interesting phenomenon, and I'm an acupuncturist, so I deal with a lot of chronic pain issues, acute pain issues. People call me up for a lot of injuries, disc problems, and a lot of times it's just older animals, geriatric animals that
Mm.
they're slowing down and
Mhm.
not not exhibiting their normal behaviors, and so a lot of them are in chronic pain, and a
Yeah.
lot of it's, just stiffness from arthritis and stuff. So, I think we as a Western culture, pain is really pain is really interesting because I feel like we're all terrified of pain. There is this huge fear bubble around pain, and dog owners come to me all the time. They're like, "But I just don't want him to be in pain. I'm just scared. I don't want him to be painful." Now,
Yeah.
so what do you know? And I totally understand that, but what kind of pain are we talking about? 'Cause there's a lot of different types of pain, and I learned this from studying traditional Chinese medicine because the Chinese, they would take really thick needles as acupuncture needles and jab them into the body, and we're like, oh, that's causing pain.
That's painful. Yeah.
But it's painful, but it's a good kind of painful because it's opening up the body to heal. So it's not negative pain. Okay. So
Yeah.
also dogs there can be nerve pain, that's sharp shooting pain that you can't get out from under. That's one type of pain. There
Yeah.
can be my doodle is
Hello. Who do
mad
we have?
people. This is Buddy.
Hi.
We inherited him. He was running around, a golden doodle running around the hills of Kentucky. So I call him my redneck golden doodle.
A golden doodle.
Yeah,
Oh,
he's very sweet. But so, yeah, there's different types of pain, and dogs will exhibit different behaviors around those different types of pain, right?
yeah.
So, there can be more like, back pain, especially cervical disc pain. The dog will just it hurts so bad that they'll anticipate the pain, so they
Mhm.
might just freeze in place and be afraid to move.
Yeah. Yeah.
And they hold there's certain postures that go along with different types of back pain. So they'll sit there and they'll just hold their neck straight out, and they won't even wanna turn their head or anything. Um,
Mhm.
I've learned all this just by examining dogs and maybe not having imaging, not being able to throw them immediately into an MRI and CT scan to find out what's wrong, but examining
Sure.
them and then working with opening up the meridian channels to relieve the pain. And then there's pain like just chronic arthritis pain, where it's a dull background pain that might not be there all the time. It may come and go. It may be in the morning where they're really slow and achy to get up. They may not even want to get up off their beds because they're so stiff and their joints are cold. So you call them to go outside and they sit, they lay there and look at you. So the owner might think, "Oh, my dog's misbehaving and not coming to me," but the dog
Yeah.
a really hard time getting up or doesn't want to move because, again, there's that, if I move, it's gonna hurt and it's too difficult. I don't have the energy to move, you know?
Yeah.
So there's a lot
Yeah.
of different areas of pain.
Totally. And it's like, yeah, like
Right?
pain is just gonna like change your experience of how you want to move around in the world. I mean,
Yeah.
I
Yeah.
know that as someone who has chronic pain myself, and like when I'm in a flare up, I have like different capacities. I have different desires. I need more, but I have the words to communicate that, right? Exactly.
Exactly. I've just
Without,
been working with my own chronic pain. I had a hip injury when I was younger, and yeah, when it's flared up, it's like I literally do move through the world much differently than
yeah,
not, you know? So,
yeah,
mm, we have to be
yeah.
aware of that for a
And I
dog.
guess there's the kind of situation that you've just described, right? Where the dog is like reluctant to kind of go out and have their day in the world, and someone's maybe not noticing that that could be, pain related, and so then they take the
Mhm.
dog out anyway, and then this. I guess I use this metaphor a lot with my clients about candles, and instead of using the
Mhm.
word triggers because but I think
Yeah.
of like they're every time they experience something that increases arousal or causes anxiety, frustration, pain, a candle is lit underneath
Mhm.
this pot of water. The pot of water is like their emotional state, and like they don't want to get out of bed, candles lit. They have to go anyway, candles lit. It's kind of janky
Yeah.
putting on harness and that caused some pain, candle lit, candle lit, and then all of a sudden they're gone through the walk and the walk is taking longer, another candle, and then they see another dog and they're just like so spent, and then they have a reaction to the dog, and then they get labeled as a reactive dog, and then we're like, okay, we need to solve their reactivity around other dogs,
Yeah.
right? But it's like there's
And
just
it
so
has nothing to do with and it really has nothing to do with that. The root problem is in a different area. Yeah.
yeah, yeah. So I think it's really important to do this kind of um awareness cultivation, because I
Yeah.
just think it's so yeah, just not kind of in the mainstream in the way that I think it should be. And I think again when I do my consultations, the one of the first things I ask is, have you ruled out pain? And often people are like, oh, no, how do I even do that? What do I do? And then
And
I
we
guess
for yeah, and we
uh,
forget that animals are like dogs and cats, for them to feel pain or to exhibit pain, I go back to each dog being an individual. So each dog has a different pain tolerance. I mean, I've seen dogs. I worked out in New Mexico for a while in an animal shelter. It was actually, I was in a private clinic at the time, and these people called up. This is just an example. These people called up every day at Friday afternoon going, "Hey, can we bring our dog in? He got shot in the leg." And we would see a lot of gunshot and knife wounds out there. It's crazy. And so we'd be like, "Yeah, bring him in." Well, it got to be a joke because we thought it was like a prank call. Because every Friday, like 3 Fridays in a row, they'd call up and say, "Hey, our dog got shot in the leg. Can we bring our dog in?" And we're like, "What is going on here?" So, like, on the 4th Friday this happened, they actually got the dog and brought the dog in. So they come walking into the clinic, and he's like, they had big Rottweilers out there. He was like a 125-pound Rottie. Comes in on a leash, and he's just got this goofy grin on his face. He's walking three-legged, holding one leg up with 2 shards of bone sticking out of his leg and a perfectly healed wound. So he'd gotten he'd gotten shot in the leg, broken the leg, his compound fracture, it had healed up, but he was still out running around, and the reason they couldn't bring him in is because he would run away from them and they couldn't catch him to get him into the clinic. And so he had a perfect, it wasn't even infected, which is the crazy thing.
Wow.
And this
Wow.
dog was walking around like, "Oh, what's your problem?" And we were all like, "Whoa, my God." And, like, no pain whatsoever. So that's, like, an extreme end of it.
Yeah.
And then there's the other end of it where I just had a little dog that I've been doing acupuncture on him for 6 years. I would get the needles out, I wouldn't even touch him, and he would already be screaming like it was gonna hurt with this anticipatory pain. So
Mm.
you have to look at the individual dog and even the individual dog breed. There are some breeds that are just like, if you barely touch them, they're like, "No, I'm in pain, don't touch me." And then there's other dogs who are like, "What? I don't feel anything at all." Not even a gunshot wound
Yeah,
for whatever,
not
or it
even a
doesn't
gunshot
affect their,
wound.
yeah, they just override it, or it doesn't affect their behavior at all because 'cause they're so stoic. So
Yeah.
that's one issue, but then if you could look at looking at how your dog deals with pain and what kind of pain might be available. If a dog for In dog world, if you're show pain, you're showing, like, vulnerability, and that's putting you in danger as well, like, if they're out on the
Mm.
streets or they spent time on the streets.
Right.
So they might have been living with pain for a long time before they actually get to the point of like, wow, this really hurts. And you're seeing something externally too.
Mm.
They'll mask it as well. Just because, and sometimes a masking might just be like, just leave me alone. Let me go over here and lay on this bed. And they might even start guarding that area. Like if another dog in the household gets too close to them or they're on a walk. And I see this all the time, especially with dogs with hip arthritis. If they're fine for you petting their head and messing around with their front end, but you go to touch or feel their back flank or something, which is also a sensitive point for dogs to begin with, and they're like, "Don't touch me there." But
Mm.
they're actually, because they're painful there.
Yeah, yeah. Yeah, totally.
So and
So I
another dog comes in, if another dog comes up to jostle them or something or do those side bumps, they're really guarded and they're like, "No, stay away from me." And they might even turn around and yip at them or bite at them to give them that signal.
Yeah, 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 and I think it's a really important point to, see your dog as their own individual being who is
Yeah.
gonna have their own pain threshold, but that also pain threshold and what they can like handle might change day to day. It's kind of like, who is your dog today? I think is a really important question and a good way to look at it. And then there is obviously the kind of clues that you can sometimes get from breed history, but without being too deterministic. I always think it's like
Yeah.
such a
Yeah.
delicate balance to hold there. But
It is
so
a delicate balance, and I know people are getting, like, this whole thing of, like, "Oh, but, you can't label a breed," but I also think there's a middle road, so I think people forget. So I live down in a place where we have all these big condominium buildings, and it's very urban, and dogs don't get to run around a lot, and I think it's really important to have a happy dog, to look at what that dog was bred to do.
yes. Yeah. Yeah. Yeah.
And the
Yeah.
purpose that that dog was bred for, because dogs, we have carefully selected behaviors in dogs, in dog breeds. So if you take like an Australian cattle dog and put them into a condominium where they get nothing but leash walks every day, you don't, it would be different if you take them out and do agility with them, if you take them out and do herding trials with them. That dog needs a job and it needs to work and it needs to use its brain. So that's another, that's one thing I see happening is, oh, we can't talk about the breed. It's just like the whole race thing. Well, we can't talk about the race or gender, but we need to in dogs because it will help us understand our individual dog better
And
and what
how
their needs are.
and how exactly that's the linchpin there, right? It's like I'm
Yes.
doing so I can understand, one, is this a suitable environment for you?
Yeah.
And two, like how can we help you find the outlets for the things that you've been bred to do in collaboration with us for time?
Yeah.
Um
Yeah.
there was a period in lockdown, so I live in East London and there's green space, but it's
Uh-huh.
London. And there was a period in lockdown where all of a sudden there was just like a trend of people buying working Cocker Spaniels.
Yeah.
Um, and it was just, I was a dog walker back then, and I had like a secret, sharing this live, it's fine, a secret no spaniel policy because it
Yeah.
was just
Yeah.
absolutely like the behaviors and the problems that they were dealing with because of like the sensory overwhelm, because of the just on a leash walking every day.
Yeah.
It's just, yeah.
Well, down
Um,
there they're doing that's a mountain. Everybody's getting Malinois. And I'm like,
yeah.
you could, please.
Is yeah. So there's so not to digress too much, but maybe
Yeah,
there's
but yeah.
a need, and it's okay. But there is maybe also a need for like awareness around how we. So many times I'm like, oh, I wish you got in touch before you got your dog. But anyway.
Exactly. Yeah. But
um,
and it's just it's learning to understand there are breed differences, and some of those breeds they are bred to be not feel pain as much,
yeah.
like literally.
Yeah. So, yes. So I'm really interested in the work that you do and how that can open up different pathways to supporting our dogs because
Mm-hmm.
my only experience of working with dogs who might be in pain is like through the kind of mainstream medical veterinary
Mm-hmm.
medicine industry, right? And
Mm-hmm.
my experience of that, it's often quite challenging. So the kind of there's usually some two main pathways that I experience this. I've got someone who's gone to the vet and they've been like, my dog's been acting this way, and they're like, find a behaviorist. And then they send them off in their way, and then they find me, and I'm like, well, have you ruled out pain? And they're like, well, I was sent to you, and I'm like, well, okay, well, we maybe need to go back and explore what's going on there. But then
Mm-hmm.
I don't know how it works in the States, but here, basically, like if you suspect your dog is in pain, you have to tell your vet, and hopefully you do enough advocacy that the vet actually listens to you and refers you to a vet behaviorist. And then that's the kind of pathway that I suggest people to go on because then they can do a pain trial or talk about anti-anxiety medication or whatever they might need. But um, yeah, I guess I've been reading your stuff and learning about
Yeah.
what you do, like, and as someone who has like a critique of the medical industry with people, like, I really wonder, like, what the limitations are there, and what we can do instead.
Well, yeah, veterinary medicine, unfortunately, it has modeled itself off of the broken human medical system because a lot of it has been corporatized. And so what I notice is actually I literally notice veterinarians coming out, graduating, and not having the same education that I received when I was in veterinary school. So what they're essentially they're teaching GPs how to refer to specialists at this point.
Yeah, yeah,
So instead of like back in the day, a dog would come into us limping or lame or with behavior, and we would go ahead and start the workup then. Like we might send them home on a trial of anti-inflammatories and
Mm,
see how they did for the next 3 to 5 days. And I remember 20 years ago when I was working in a clinic, and I was like, if it doesn't start improving, keep them quiet, let it rest. If it doesn't start improving, bring them back in a few days, and we'll do X-rays. And we would do the X-rays right there, and we would read the X-rays out right there. I mean, I learned how to read my own radiographs.
mm,
Vets now, you go in, you have to, they may do the X-rays, but you got to wait 2 to 3 days just to get the radiology report back from the radiologist reading the X-rays. So it's become a much different, and it's confusing for the pet parent. It takes more time. Things
mm,
get lost. If you don't screen for arthritis, then and send him to a behaviorist, then they throw him on something like trazodone, which just drugs the dog up. They're still in pain. It's not doing anything for the pain, but the dog's just laying there staring at the wall because they're drugged up.
mm,
So there's a bunch of issues around this, but I would and then the other big issue now is they came out with Librela, so they're telling vets, oh, you can't use anything to treat arthritis except for this injection, which is causing really, really, really horrible problems, fatal, irreversible issues, side effects. So people can go to my Substack and read all about that. And it's been going on. This month will be 2 years since I raised the alarm on that. But so if you have, what you need to do is find a vet who may have been trained in acupuncture or has a different outlook and wants to dig a little bit deeper with your animal, and who's willing to talk with you and spend time. So to actually do a lameness exam, it's called a
mm,
lameness exam, and a neurological exam. So you take the dog out, you watch them walk back and forth, at a walk, at a trot, at a run. They put their hands on the dog, and they flex and extend all the joints and palpate the joints, palpate the neck. And acupuncturists will do this as well, just to feel where, there's a lot I can tell just palpating down the back of a dog, whether there's heat, whether there's cold, whether there's pressure. Are they reactive to a certain point over another point? It gives me a lot of information. But they've got to put the hands on the dog, then actually extend and flex their joints. They feel for thickening of the joints, hotness, all of these different things,
mm,
all the way down to the little joints of the feet. Now, a lot of times you won't get that from a regular vet. You have to wait until you go to an orthopedic vet. And even neurologists, my local neurologists here aren't even doing neuro exams. They're telling people, oh, we've got to do a $5,000 MRI. When it's like, put your hands on the dog and examine the dog and get some information first.
mm.
So, even finding an old time vet, like an old time farm vet, you'd probably be better off with these days than, somebody who's got all the fancy equipment, let's say,
Yeah,
you know?
yeah. And I think, oh, such a good point there of like, well, we need to actually just like stop and observe,
Yeah.
if
Yeah.
we do limited in what we can access, or we're not feeling listened to by the vet, or if like going through that process might take a long time, like, you know, having the kind of like the skills to be able to be like, to have that information and know what you're advocating for is really important. So I use Tellington T-Touch in a lot of my work. I
Oh,
don't know.
yeah. Yeah. I love T-Touch. Yeah.
Yeah, yeah, yeah. And so, for those of you who don't know what T-Touch is, it's kind of like a combination of like body work and movement exercises that work to shift it,
Mhm.
like self-carriage, like how they hold themselves. And it's something that I'm practicing for 3.5 years now, but it's something that I feel like I can simply teach someone in one session, and enough for them to like kind of take away and work with.
Yeah.
And we do is like cultivate your observation skills. Like, we have different kind of categories of observation, and like, what are they, how are they holding themselves? What's their tail position? What's their ear position? Are they walking with their weight evenly distributed around their paws? Like,
Exactly.
what's their
That's more than most. That right there is just more than most vets even. Look at I'm sorry to say, but those are all things like I learned in the shelter watching dogs because, a lot of it was, is it even safe to open this kennel door to deal with these dogs? They will tell you right away, but people aren't used to watching for those small behavioral cues.
Yeah.
And dogs get very subtle. I worked with there's a really awesome woman, you would probably I don't know if you're aware of her, Carolyn Ingram. She's actually over in the UK. She does this great work called, um, animal zoopharmacogeny, where she does self-selection of essential oils and things with dogs. But when you're doing a session, I worked with her. She came to the States and I worked with her for 2 weeks. But when you're doing a session with an animal doing that, dogs, like horses will tell you right away, cats will tell you right away. Dogs give really, really subtle signals. They'll start out subtle and then they'll get louder and louder and louder if they don't really like something. And so I think watching them, it can be that really quick side glance over at you, if something's bothering them. And I watch for this as I'm putting acupuncture needles in as well. It's kind of like I did T-touch way back when I was in vet school, but it's like that. They'll let you know it might be a small flinch, it might be a small movement away or towards, if that feels good or that doesn't feel good. They want more pressure there or they don't want pressure there. So the more people can like just put down the phone and be present with their animal, like really be present and
Yeah.
spend time with them and put their hands on them, and T-touch is a great way to do that.
Yeah, and it's really accessible in terms of like,
Yeah,
if you basics and you just kind of cultivate your practice,
yeah.
it's
And
really something.
like
can-
co-regulation of the nervous systems too.
Yeah,
It
yeah,
regulates your nervous system with their nervous system and can relax both
yeah,
parties.
yeah. There was a study done recently, and
Uh-huh,
we're practicing T-touch, and um,
uh-huh.
so just for so the idea of a still point, I don't know if that's something that is kind of familiar to you, but I'm gonna just explain it to the people
Yeah,
watching. But
yeah.
different rhythms in our bodies, right? We've got our circulatory kind of
Mhm,
like, we've got our cranial sacral rhythm, which is like the movement of
mhm,
fluid in our spine and our skull. I don't know. And there's this kind of like point when we're receiving different types of body work that's called a still point, when that rhythm in our cranial sacral like rhythm, it just stops. Uh,
mhm,
and T touch, when you're doing T touch on a dog, it creates that still point. But what
mhm.
the also found was that the people who were practicing T-touch, whether they were practitioners or people who were just taught that in a session, it also creates a still point for them. So
Awesome, yeah.
mo- the
I know
potential,
what you're yeah, I hadn't had the terminology to it, but I know exactly what you're talking about because the same thing will happen with acupuncture. I'll put in like these relaxation points and permission points, and they'll come a certain point during the treatment where it's just this like, it's just like, yeah, yeah,
yeah. So it's just something that is really something that you can do for your dog, and it has benefits for you too. And
yeah.
just going back to the idea of like observation, I'll put some kind of like T-touch observation categories and things to look at when this kind of gets sent out as a post. But for those of you watching, like a great way to kind of observe your dog is to set up a free work course in your garden, or if you don't have access to that, just put some treats around in your living room, right? And
Mhm,
use these categories and just watch your dog. Are they walking around in a only one direction? Are they walking
mhm,
kind of tentatively or stiffly, or just what are you seeing without analyzing it? Like, observe without judgment, right? Just say what you see, don't put any meaning to it. And then
mhm,
another kind of do that is you're observing with your eyes, but then with your hands. So you were talking about this example of a dog who you can pet on the head, fine. And then you go down to the hindquarters and they're like, get the
Yeah.
fuck away from me, right? Um, and like a deep touch technique that you could do is just using the back of your hand, just doing like short connecting strokes. Because
Mhm.
you're not going along the whole dog and then being like, how do you react? It's just like a little bit and
Mhm.
stop. And they're like, okay. And a little bit down and stop. And then you find the point along the spine down to the hindquarters where they're like, even if it's just that little look, it's exactly as you just said. Like it can be a
Yeah,
subtle reaction that you're like, okay, you have some level of concern there, whatever it is. So
exactly.
these are things that if you're concerned about your dog's behavior and you want to understand if it's um, pain related, like go away and just write down all the things that you can think of that might suggest it in terms of body language, behavior, how they're holding themselves. And take that information with you to the professional that you're going to see. If you've got to go to a vet because of insurance or because that's what feels accessible, at least you're equipped with that knowledge. Or if you go to
Mhm.
someone more on the holistic side, then you've
And
got
that'll help the vet. It'll help the vet because sometimes they don't have time. They should have time if they're being a real doctor, but they often don't have time because especially these corporations are like, "You have 15 minutes with this patient." I can spend 15 minutes just saying hello to somebody, but, but I go into people's houses, so that's the other thing I found out by doing house calls, and I'm sure you see this, is you see the animal in the environment they live in. So they're much more relaxed. They're not gonna be guarded. You can
mhm,
watch, like, do they sleep on a bed that's 3 feet above the floor and they're jumping on and off that every day? Or what, where are their water and food bowls? Are there slippery floors? Like, down here, we deal with a lot of wood floors, marble floors, tiled floors, and these dogs are slipping and sliding every time they get up. By the time they're, like, 10, 11 years old, it's painful to do that, you know? So you gotta look at the environment they're in as well. But if you go to a veterinarian with all these little things written down, that can help them clue in a little bit faster of what's happening, you know? Is
yeah,
it their knee? Do you think it's their hip? Maybe it's not pain at all. Maybe it's some other problem that they're having, but yeah,
yeah, just being able to be equipped to be able to do the app, right?
yeah.
So yes, we talked a bit about it, but I guess I wonder if there's anything else in terms of um what we can do instead. We're doing the observation, we're writing the things down. Maybe we've got enough of a sense of like, okay, I don't want to go to the kind of more mainstream vet for these reasons. Where can you go? What can you do? You talked
You
about
can you can look up a veterinarian who's been trained in chiropractic care or, acupuncture. You could go to a massage therapist that
mm,
a good massage therapist for a dog, the massage, if it's soft tissue, may be enough to help get them out of pain because we all know if we have pain, like nerve pain, then the muscles tighten up around the nerve and then the nerve pain gets worse. And if you can loosen up those muscles and get the lymph flowing and the circulation flowing through massage, that can do a lot, especially to help an older dog or even learn like doing the T-touch and then learning some massage skills on top of that. Um, Going to even a nutritionist. I
yeah,
see, okay, so much of the highly processed dog food is actually pro-inflammatory. So you
yeah,
are just adding inflammation into your dog's body. And when you get inflammation in the joints, you have arthritis. When you get inflammation in the muscles, you've got myositis. So getting them on an anti-inflammatory diet, fresh food diet, and doing some things to help support the joints, like collagen, bone broth. Bone broth is like a favorite of mine to help both with the gut and the joints. And it's going to give you the joints collagen and help keep them moisturized. And then things like green lip mussel, sardines, omegas to keep everything moisturized and lubricated in there. So there's lots of different avenues that you can work at.
yeah. And again, like that combination of being able to seek out professionals who have a more
Yeah.
holistic
Yeah.
understanding.
And
And
herbalists too. I mean,
yeah,
every single one of my patients is either on Chinese herbs, Western herbs, depending upon what's going on and what I'm treating.
Yeah, yeah, yeah. Which again are things like, you go and you access the knowledge from a herbalist and then you have that and you know what your dog might need in a long-term
Yeah.
sense.
Yeah.
Yeah. Hmm.
Yeah.
Well, it's been really fascinating. I really appreciate you kind of coming on here and talking about this because again, I just think it's such an um it's not really talked about in the way that it needs to be. And there's just so much more to
Yeah.
a dog's behavior than like I need them to stop doing the behavior. It's like what
Yeah.
is the behavior saying about what they're experiencing?
Well,
And
yeah, and what are they trying to I mean, what are they trying to communicate to us? Maybe that's the first thing. Like, all I hear anymore is like, aggressive dogs, reactive dogs, and I see trends in training where I am very selective at any trainers I will recommend for my patients. I mean, over here in the States now, the big thing is they're going back to like prong collars and shot collars and this type of aversive training. So, say, just imagine I like right now, I'm dealing like I have an old injury in my hip, or if you have chronic pain somewhere, and somebody puts you on like a shock collar and was like, well, if you don't walk this fast, I'm going to shock you. Or if you decide to stop and not do this or veer away from this dog, I'm going to shock you. What is that? That's going to just screw with their heads so
it's
much.
violent. It's so
You
it's
don't yeah, yeah. And people are like, "Oh, well, it doesn't really hurt him, and it's just this and this." And my answer to that is, "Let me put that on you
let me put that on.
24 hours,
Say that every
and I
time.
got the controls, so let's go play, and let's see what it does, what it
Yeah.
does to because I don't think that's a good way to develop a good relationship with your dog.
Yeah, yeah, yeah. It's
You know?
just I just I'm always like, before we went on this call, we went on live, we were talking about the kind of example of how do I get my dog to stop barking when someone comes to the door and we're like, oh, okay.
Yeah,
However, are dogs and they bark at the door because they're informing you that someone's there. And that's kind of like they've been doing us that solid favor since we were like sitting around the fire and like we didn't want to,
exactly.
right? And I'm always like, when did the shift happen? Like when did we go from collaborators and companions to like owners and masters and like I'm gonna just shock you until you do the thing that I need you to do. And I just think there's like so much that we
Yeah.
need to do in terms of like healing this like relationship with these beings that we've co-evolved with. And like one of the things that we can do that's accessible to us is just pay the fuck attention. Sorry.
I think it is pay attention, but I think we have we've become disembodied. I follow some really interesting thought people. Like some of them are astrologers and kind of on another thing, but people that
Cool.
are writing about this whole AI thing and how much social media and how much the digital world has changed our lives. And we have become a disembodied species. So, you talk to the whole thing with therapy right now is bringing people back into their body and doing somatic therapy, right? Being here in this physical body, in this present moment, even though I'm talking to you on the computer, I'm sitting in a chair. I feel myself sitting in the chair. My dog's down below me and being present here instead of being off in la la land in a screen world. And, we don't want our dog barking because we're on the screen. And I watch people, I'm not a big fan of dog parks, but I watch people all the time. They're out walking their dogs and their thing is in their phone and their dog is trying to tell them something and they're not picking up the cues. So the dog has to escalate it, escalate it, escalate it, escalate it to the point where the dog is now becoming what they're calling reactive, when in reality, they're like, hey, mom, there's a dog up ahead of us and I don't want to go that direction. I want to go this direction. And the person is completely checked out, clueless as to what's going on. And I also learned this is another thing I wanted to bring up when I was out in New Mexico had a lot of stray dogs. They were domesticated dogs, but they were out roaming and hunting. And we would go up on these mesas and we would watch them, like 4 or 5 dogs out in the desert roaming in these packs. And they would be about maybe 3 to 4 feet apart from one another. And they would literally be walking through the desert, seeing what they could stir up, and checking out the territory. And there's usually a leader of that pack of dogs. Whether we want to call them a pack, we can call them a family group, whatever we want to do. But there's usually a leader, and the other dogs are watching the subtle signals from that dog as to what is going on in the environment. Is it safe? Is there something they need to look out for? Are they turning left? Are they turning right? What's going on? And they're subtle because they're hunting, so they don't wanna they're not
Yeah.
being loud. So our dogs look to us as their, like, leaders, as their protectors, and when we're checked out, that
Mm.
all of a sudden puts them in this really vulnerable position. They're trying to get our attention, and they're not getting it. Right?
Yeah.
So they're
Yeah.
gonna be like, "Whoa, hey," until they amp it up.
Exactly. Yeah.
And then
Yeah.
their own anxiety amps up from that because they don't feel any connection to us on the other
Yeah.
end of the leash, you know?
Yeah.
It's
Yeah.
really and I think that's I've really been trying to work my head around this, and then what a lot of the behaviorists are doing in this country is they're putting them on SSRIs, which we already know the problem those are causing in people. Things like trazodone, it's a short-acting SSRI, which is putting that dog on this emotional roller coaster.
Yeah.
Gabapentin, which is just letting him check out, um, and as does nothing for pain. I will put
Yeah.
this in there. So they're putting them on drug cocktails on top of their owners not paying attention to the dog.
Yeah.
It's really
Yeah.
sad.
Yeah, and it's like, you just said we're putting them on these drugs so they can check out, but actually what's needed is for us to check in more.
Check in.
Mm.
Exactly.
And so I guess I'm wondering, like maybe I've got a suggestion of how we might end this call, because you've talked about we're on the screens and we're disembodied, and I completely agree. And me, you, and 11 other people have been on a screen, right?
Yeah.
And there's like things that we can do. I try and do when I'm working to get back in my body, and things that like small somatic practices that if you maybe do ahead of a walk or ahead of petting your dog's going to feel a difference and you're going to feel more present. So there's a Tellington Tea Touch, like little movement called a heart hug. And maybe we can end on a heart hug, and
Yeah.
then watching can end on a heart hug. So does that sound something that might be
That
nice?
sounds wonderful. And
Okay.
yeah, these techniques, and I think it's really important for people to start incorporating them into their daily life because
Yeah.
it doesn't take that long to do and it can really make a difference. Yeah.
Yeah, yeah. Okay, so I'm gonna just guide us through something. You're meant to have two hands, but my phone holder's being weird, and so I'm holding my phone up with one hand, but everyone else can use two. And so basically, we're gonna do a type of T-touch technique called a circle, and when we go through a circle, we're all gonna picture a clock, and the movement around the clock is a full entire rotation starting from 6 1/4. Um, and so what we can do, we're moving our skin, we're not sliding around our skin, but you can place your hand on your heart and then place your other hand on your other hand if you have access to that. And you might just take a second, we're talking about kind of activating things. And so just
Take
landing
some
and ground.
breaths. Yeah.
Yeah.
Notice
Take
your
some
breath
breath.
is a good one.
Yeah. Yeah. Just notice. And then you might just really slowly move the tissue around your heart, that full circle in a quarter. So you might go 6, 9, 12, 3, 6, 9. And when you get to 9, you might take a breath in and just lift that tissue upward. And then bring it back down. And that's really it. And, if you're having a stressful moment on your walk with your dog and you need to do some self regulation before, you need to interact with your dog because they've just seen another dog and you can't hear one more bark without your nervous system pinging off. Or if you're going to pet your dog and, you want to be really present in that touch, like just quick little heart hug, puts you into heart connection, and your dog can feel that. They sense your energy, and just
Yeah.
those little micro mindfulness moments just can make a huge
Huge.
difference for how you engage with your dog.
Yeah.
Yeah. Well,
Definitely.
thank you so much for joining
Yeah.
me today. I've really enjoyed this conversation. Thank you, everyone, for watching. I've really enjoyed doing this series in general, and we've looked so far about the limitations of dog training. And if you're interested in what's beyond that, I've got an online course coming up in January called From Reactive to Resilient. And we look at all of the different pieces that can support a dog to move from that state of just in reaction to kind of like calm and responsive. And there's a lot of T touch in there, and I'm really looking forward to that. So I'll link that down. But Josie, I wonder how other people can find you or the work that you do.
You can find me here on Substack, and I'm actually doing a live right after this on red light therapy for dogs, which is a good therapeutic modality as well. And I do online consultations if you're not in South Florida. So I do one-on-one online educational consultations on diet, supplements, herbs, things like that, and things that they can do at home to help keep their dogs healthy and prevent diseases as well. So if you can't find a holistic vet near you, and I do peak coaching. People will go to regular vets and specialists. I give second opinions and things like that. So I'm available.
Amazing. Great. Okay. Well, lovely chatting to you. Good luck with your next live.
Yeah. Yeah, definitely. And
Thank you so much.
thank you. Yeah, thank you for having me on here. Your program sounds wonderful. T-Touch it's a great modality, and it's super easy for people to learn. And it makes a big difference with dogs. You can see immediately when you know,
Yeah,
when you
it's
do it
kind
on
of
them.
it's weird body magic. Like sometimes,
Yeah.
in a sense, I've been doing this for 3 years, and I still have moments where someone's like, see something that happens immediately, and in my head, I'm like, oh shit, it
Yeah.
works. It's just like it
Right.
just happens immediately.
I'm the same way with acupuncture. It's like, what are these little tiny needles doing? And then you get this result, and you're like, wow, yeah.
Yeah,
Yeah.
yeah,
So
cool.
it doesn't, yeah. All right. Well, thank you so much. We'll
Take
touch.
care.
Yeah,
Thank you.
you too. Bye bye.
Bye.